So I give patients an analogy in the clinic, which might be a little bit hard to hear, but it really does help them visualize what's happening to their vulvovaginal area. So I talk about either a succulent grape or a pleated skirt. So that is premenopausal. The vagina is lubricated. It has ability to secrete. It can accommodate. It can stretch. There are rugae there. It can birth a baby. It can be functioning for sexual intercourse, and it's well estrogenized. And then when a woman enters and then proceeds into menopause, the succulent grape turns into a shriveled up raisin or a tight pencil skirt. So the tissues become very thin, very pale. The ability to have adequate moisture and lubrication ceases, and it becomes very tight, irritable, and intercourse can become very painful. So those present for women with vaginal dryness, burning, irritation, and pain with intercourse. So that's sort of the vulvovaginal presentation.
Okay. And then let's talk about the bladder side effects.
So the bladder can present differently. For some patients, that can be increased urgency and frequency. So that basically means that you all of a sudden have an urge to go to the bathroom and you're sort of trying to get there. You may even leak a little bit of urine. Frequency meaning the desire or the feeling that you need to go void. But when you get to the toilet, you just don't have a lot of volume there. There's also some stress incontinence, which sort of is more so related to aging than specifically the loss of estrogen. A lot of patients also tell me that now all of a sudden they're waking up and using the bathroom in the middle of the night, which can be very disruptive if they are also waking up with vasomotor symptoms or night sweats. And then there's also a tendency for women to start having more urinary tract infections. So we know that when you are estrogenized in your vagina, the pH of your vagina is more acidic. And as you enter and proceed into menopause, it becomes more basic, the lactobacilli drop, and there is a more chance of urogenital bacteria to enter into the urinary tract, and that's how more urinary tract infections occur, which maybe a woman had never previously had. And a lot of women do not recognize that urinary symptoms are associated with menopause, so it's really important that we explain this to them and let them know ahead of time so they know what to look for.